When I started medical school, I assumed I would leave here knowing all I needed to know to be a good doctor. I soon found, however, that it is impossible to learn all of medicine in 4 short years. What I have learned is how to become a problem solver and a lifelong learner. Here we are given a strong foundation of knowledge, and then we learn where to go to build on that knowledge. We learn how to seek out what we need to solve the medical problems that we face. And through this process, we find the answers to help the patients that we are caring for.
I was really honored to be able to speak at the groundbreaking ceremony. I felt that the University of Iowa College of Medicine was giving me a great education and a great opportunity in my life. Looking back over the last 10 years, I think I would take away that same idea that I presented at the groundbreaking ceremony, not knowing then that it would mean as much to me now.
I'm glad to provide you today with this report on medical education. I want also to take this opportunity to thank you for the tremendous support that you give to the Carver College of Medicine. You will see in this video why we are leading medical education among all medical schools in this country. I want also to introduce Dr. Paul Rothman, the new Dean of the Carver College of Medicine. Under the leadership of Dr. Rothman, the future of the college is in excellent hands.
In medical education, we clearly are recognized as a leader of innovative curriculum. We're looking to try to plan the next stage of innovation of medical education. I enjoy interacting with the students. They're a lot of fun. They're very excited as they start the medical profession. To have a facility such as the Sahai's have supported here at the University of Iowa is tremendous. What they've done for Iowa is just an outstanding contribution. We just feel great thanks to them for what they've been able to do for us.
It's a beautiful day here in Iowa City in October, and I'm speaking to the entire Sahai family, and I'm reflecting on at least 10 years of a tight association between the college with the Sahai family. So I want to thank especially Urmila and Prem, Subash and Sue, and Anil and Newton. We owe you a deep debt of gratitude. This last decade has tightly linked the Sahai name with excellence in medical education. We are very proud of that excellence, but we don't want to dwell on the past excellence. Today, we want to bring you up to date with excellence for the future. And never before have we had the excellence in faculty to promote our educational programs. These faculty have been developed in large part through your efforts and support. And then we're going to share with you the reports from 3 of our outstanding students. We hope you'll find these reports energizing, revealing, and most of all that you'll enjoy them.
Here in the Sahai medical education is the very core of the simulation we use with our medical students. Our students learn how to do a history, how to do a physical exam, working with the simulated patients. They're both simulating patients and also acting as instructors. Students get a fair amount of simulation also in their lectures, where we're using multimedia productions to help them understand biochemical mechanisms, pathophysiology, trying to make things very visual. On the clinical wards, we're starting to use simulation in terms of mannequins with heart sounds. Anesthesia and emergency medicine have clinical labs where they train their residents on how to do resuscitations, how to identify unstable patients and test their clinical skills. So we're seeing simulation all through the curriculum from day 1 until a resident graduates. And it's a very exciting time for us here at Iowa.
In family medicine, we have a very valuable cadre of preceptors across the state, about 130 volunteer community preceptors who serve to both educate our students about clinical topics and also to provide an experience about what is family medicine. So I think the enthusiasm that they show to the students about what family medicine is, what primary care is, the importance of it to the communities really helps generate a sense of pride in the specialty and encourage students to consider that as a career option.
One of the themes that I emphasized when we first rolled out the new version in 2007 was teamwork. And this year we advanced the theme of teamwork even more. The idea of having physicians working side by side with pharmacists and nurses and physical therapists was advanced during clinical beginnings so that students worked in groups with team members from all of these disciplines. And they learned a great deal about these disciplines that they don't learn in the first 2 years. So that when they start their clinical clerkships, they're much more prepared to work in a team and to understand the role of the other team members.
I did a survey of different rural health training programs that are available to medical and other health professional students and realized that there wasn't really a program that, that brought students from multiple disciplines together for a training event. The AMSA Foundation initiated its first Rural Health Scholars Program that was hosted and sponsored by the Carver College of Medicine. And I had 23 students from 14 states that came here for the week, and we focused on didactic sessions and covering a wide range of issues in rural health. It was a long week, but well worth it, and I really feel that these students had a valuable experience. The Rural Health Scholars Program reinforced to me my interest in primary care workforce development, and it's changed my perspective on medicine in realizing that workforce development is a global problem. It's going to take a matter of looking at our educational policies and what our needs are and making sure that we put policies in place so we can put folks that will take care of patients in areas where we most need it.
Global Programs has a lot of really passionate and dedicated students who really are motivated by the opportunities that are available to them within the program. Most recently, we've traveled to Ecuador and Nicaragua in Central and South America, in which we've had the opportunity to work with underprivileged families, communities, and help them rebuild their healthcare infrastructure. You learn to be on your toes, different clinical scenarios that we've encountered here in our coursework. I've been able to observe abroad. We have weekly seminars that allow students to have mentorship opportunities with faculty who have done a lot of research abroad, had a lot of clinical experience abroad, and how we as students can learn from them, from their experiences, and try to incorporate that into our practice as students and future physicians.
I created my own service project in which I go out now with a bigger group of students and faculty who go and see migrant health workers here in eastern Iowa providing basic health care screening. The fact that the community here at the University of Iowa recognizes through Service Tract, it kind of encourages me to keep doing that kind of work. So if I get to see, for instance, a diabetic patient, it's not only going to be in my clinic that I get to see him, I actually can go out in the community and maybe do some education. I think it gives me new ideas into new things that I can actually do in the future. Before I thought about working with the undershirt, but now I know for sure this is what I really want to do.
I think my education here prepared me greatly for my medical career. I felt very comfortable in family medicine. I felt that would achieve the goals that I wanted to achieve while I was in my career. And so it was really a very good choice for me. This is a real state-of-the-art facility. I think it's moving forward with the way medical education is going.
I feel like I got a very well-rounded education here. The faculty are very passionate about teaching, and I really couldn't imagine going anywhere else for medical school.
It's a very collegial atmosphere, very friendly, open, and everyone has an open door policy.
The faculty and everybody is so really just concerned with kind of bettering you as a whole person.
I've had a great experience here at the University of Iowa. I think it's an excellent teaching institution. I've enjoyed the people. I think the faculty and staff are excellent, and overall, people in Iowa are very generous and very pleasant people to work with.
But I think the University of Iowa College of Medicine provides a wonderful foundation for lifelong learning, and it really is a springboard for people to be able to pursue whatever they want in their career.
Again, I want to thank you for partnering with us and for your support over the years for the Carver College of Medicine.